Hello, everyone. Have you ever wondered how it is that one of the smallest links in our body can decide our entire health? Today, we will dive into the fascinating world of a molecule with a surprisingly broad spectrum of activity, N-Acetylcysteine, or NAC for short. This journey is not just for those who treat, but for everyone who wants to understand how their own internal survival mechanism works. In an era where chronic inflammation and oxidative stress constitute the silent architects of many civilization diseases, understanding the tools our body has for self-defense becomes fundamental knowledge. N-Acetylcysteine, although often primarily known from pharmacy shelves as a cough remedy, holds a potential far greater than we think. In the remainder of this material, I will present a professional analysis of this fascinating molecule, which will connect the precision of biochemistry with clinical practice. Let's begin. This material is purely for health education and informational purposes. It does not constitute a diagnosis or individual medical consultation. In case of health problems, please consult a doctor or other qualified healthcare professional. Decisions regarding your health should be made after a thorough analysis of your health status by a specialist. To fully appreciate N-Acetylcysteine, we must first understand the concept of glutathione, the main endogenous or internal antioxidant. Glutathione is a tripeptide composed of 3 amino acids, glutamate, cysteine, and glycine. It is the master of detoxification and the cell's bodyguard. But glutathione cannot be formed without cysteine, and this is precisely the key role of N-Acetylcysteine. N-Acetylcysteine is, chemically speaking, a modified form of the amino acid L-cysteine. It is the acetylation of cysteine that makes N-Acetylcysteine a highly bioavailable molecule. The body effectively absorbs it and then rapidly metabolizes it into cysteine. Cysteine is then the critical substrate essential for the synthesis of glutathione in the liver and other cells. In situations of increased oxidative stress, whether through infections, exposure to toxins, or chronic diseases, the demand for glutathione drastically increases. It is then that N-Acetylcysteine supplementation becomes the most effective strategy for rebuilding and maintaining its high level inside the cells. Why is this so important? Because when glutathione levels fall, our antioxidant defense begins to crack, opening the gates for mitochondrial damage and diseases. The main driver of clinical interest in N-Acetylcysteine is its powerful antioxidant activity. This happens in 2 ways: indirectly through glutathione synthesis and directly through independently neutralizing free radicals. N-Acetylcysteine is capable of directly neutralizing hydroxyl radicals and other reactive oxygen species. It acts like a sponge that absorbs these unstable, harmful molecules before they can damage DNA, proteins, or cell membrane lipids. This immediate protection is especially valuable in cells with a high metabolic rate, such as neurons or hepatocytes. No other function of N-Acetylcysteine is as clinically established as its role in liver protection. We know perfectly well that the liver is the main detoxifying organ. Although N-Acetylcysteine does not occur naturally in food, it is an essential antidote in case of medicine poisoning. The most spectacular example is its use in the event of paracetamol, Acetaminophen overdose. Toxic paracetamol metabolites rapidly deplete glutathione reserves in the liver. N-Acetylcysteine, by supplying cysteine, enables the rapid regeneration of glutathione, thereby neutralizing toxins and saving liver cells from irreversible necrosis. Understanding this mechanism is crucial for doctors. It is one of the few cases where a biochemical precursor is recognized as a life-saving drug. The scope of N-Acetylcysteine's action does not stop at the cellular level. Its effects are visible throughout entire systems. The second commonly known application of N-Acetylcysteine is its mucolytic action. How does N-Acetylcysteine thin mucus? This molecule has the ability to cleave the disulfide bonds that are responsible for the sticky, thick consistency of secretions in the airways. By cutting these bonds, the mucus becomes thinner, easier to expectorate and remove. This makes N-Acetylcysteine a valuable support in the treatment of respiratory infections, chronic obstructive pulmonary disease, and also in patients with cystic fibrosis. N-Acetylcysteine also has a significant impact on metabolism. It reduces the concentration of homocysteine in the blood. A high level of this amino acid is considered an independent risk factor for cardiovascular diseases because it damages the vascular endothelium. Supplementation with N-Acetylcysteine helps regulate this parameter, offering an additional layer of cardiological protection. Furthermore, there is evidence that N-Acetylcysteine supports the metabolism of cell membrane phospholipids and may have a moderate effect on lowering blood pressure through the modulation of nitric oxide. More and more research is focusing on the role of N-Acetylcysteine in the central nervous system and its ability to modulate inflammatory processes. The brain is an organ that consumes enormous amounts of oxygen and is consequently particularly sensitive to oxidative stress. Glutathione is the key defender here. N-Acetylcysteine, by crossing the blood-brain barrier, supports glutathione synthesis in brain cells, offering neurological protection. Interestingly, N-Acetylcysteine also influences the modulation of certain neurotransmitters, especially glutamate. This plays a role in potential applications in psychiatry and neurology, such as support in the treatment of addictions or neurodegenerative diseases where glutamatic disorders are a frequent element of pathogenesis. The anti-inflammatory action of N-Acetylcysteine is closely linked to its oxidative activity. Reducing the load of free radicals automatically reduces the inflammatory cascade. N-Acetylcysteine can also regulate the activity of pro-inflammatory enzymes and cytokines, which impacts chronic disease states. Moreover, it exhibits anti-apoptotic action. It prevents the self-destruction of cells, apoptosis, induced by severe oxidative stress. In practice, this means stabilizing and increasing cell survival, which is fundamental for maintaining the integrity of tissues and organs. N-Acetylcysteine is not a vitamin and does not occur naturally in significant amounts in the diet. Talking about an N-Acetylcysteine deficiency thus comes down to insufficient cysteine resources and consequently the depletion of glutathione stores. So, what are the indications for N-Acetylcysteine supplementation? When oxidative stress exceeds the body's regenerative capacity, consequences appear that we can link to an insufficient supply of the glutathione precursor. I will now describe the most important consequences of an inadequate amount of glutathione in the human body. Firstly, it is increased susceptibility to cellular damage, which leads to the intensification of chronic inflammation, acceleration of aging processes, as well as damage to the liver and neurons in the nervous system. Secondly, it is reduced immunity and detoxification capacity. With a deficiency of glutathione, the body has difficulty eliminating environmental toxins and pathogens, resulting in weakened immunological functions. Thirdly, it is respiratory system problems. Thicker mucus and difficulty in removing it exacerbate the symptoms of lung diseases. And fourthly, it is increased cardiac risk, because the rise in homocysteine concentration we mentioned increases the risk of cardiovascular diseases. Therefore, N-Acetylcysteine supplementation should be considered for individuals exposed to high levels of toxins, chronic inflammatory conditions, intense physical exertion generating free radicals, and also as support for specific disorders of the respiratory system and liver. N-Acetylcysteine is a molecule that deserves to be called a regulator of oxidative homeostasis. Its role in medicine is multidimensional, from a life-saving antidote for paracetamol poisoning, through an effective mucolytic agent, to the precursor of glutathione, which constitutes the pillar of our antioxidant and detoxifying defense. For the patient, N-Acetylcysteine is a tool supporting respiration and general cellular vitality. For the student and doctor, it is a fascinating example of how a simple molecule can strategically intervene in complex biochemical pathways. The key to health often lies in understanding and supporting our innate defense mechanisms. N-Acetylcysteine gives us this opportunity by providing the key raw material for the internal health factory. Let us remember, understanding biochemistry is the first step toward conscious clinical intervention. We hope that this material has inspired you to deeper investigate the power of this extraordinary molecule. And now for the most important part. Have you had any experience with N-Acetylcysteine? Let us know in the comments. We are interested in your personal effects, as well as any unexpected positive or negative consequences you have observed. Let's create a substantive knowledge base together. If this material was valuable to you and helped organize your knowledge, please leave a like. And if you want more reliable medical knowledge, subscribe to our channel. Thank you and see you in the next video.